Hi guys, so about HELLP syndrome, no HELLP status, HELLP stands actually for hemolysis. It's a question of your big exams. Let's clarify these misunderstood points that confuse you on your big exams. That will be helpful not on for your big exams as well as in your future medical practice. So let's go. So HELLP, what is HELLP? HELLP stands for hemolysis, elevated liver enzymes, and low platelet count. But its pathophysiology is much more complex. So the acronym HELLP provides a basic framework, but it doesn't fully explain the intricate mechanisms at play. It's not just about these elements. It's a syndrome reflecting widespread endothelial dysfunction and systemic inflammation. So what is clinical importance? Relying solely on the acronym can be misleading. You need to understand the underlying pathophysiology to appreciate the potential severity and guide appropriate management. Endothelial dysfunction leads to platelet activation, microangiopathic hemolytic anemia, and hepatic sinusoidal obstruction. So these obstruction leads to increased intrahepatic pressure, which causes hepatocellular necrosis and elevated liver enzymes. Next, so HELLP syndrome is a variant, complication of preeclampsia, but can occur without hypertension or proteinuria. While HELLP is often considered a severe form of a preeclampsia, about 15-20% of women with HELLP syndrome do not have preceding or concurrent hypertension in proteinuria. This makes diagnosis particularly challenging. Clinical importance. Always consider HELLP in the differential diagnosis of pregnant of postpartum women presenting with right upper quadrant pain, nausea, vomiting, or general malaise, even if their blood pressure is normal and they have no proteinuria. So a high index of suspicion is crucial. Okay, my beloveds. Then, HELLP syndrome can occur antepartum, intrapartum, or postpartum, often in the third trimester. Most cases, of course, around 70%, develop before delivery, usually in the third trimester after 27 weeks. However, a significant proportion, up to 30%, occur after delivery, typically within 40-80 hours, but sometimes up to a week postpartum. What is clinical issue of that? Postpartum HELLP is particularly dangerous because its symptoms can be attributed to normal postpartum changes, leading to delayed diagnosis and treatment. Continue to monitor women closely in the postpartum period, especially those with the risk factors for preeclampsia. Be especially vigilant in the first 48 hours postpartum. Then, next point that confused you. The exact etiology of HELLP syndrome remains unclear. You have to say that. So don't be scared. Don't think, yes, we do not know HELLP syndrome causes. Yes, etiology remains unclear, but placentation issues and exaggerated inflammatory response might be a key. They are key. So the specific cause remains elusive. Defective placentation leading to poor uteroplacental perfusion is considered a major contributing factor. These triggers an exaggerated systemic inflammatory response, endothelial activation, and coagulation abnormalities. Clinical issue. Because we do not know exactly what causes HELLP, prevention is primarily focused on management risk factors of preeclampsia, so drinking water. This is the hydration problem, such as chronic hypertension, the same, diabetes, and multiple gestations. Early recognition and prompt treatment are essential. So then, symptoms can be vague, non-specific, mimicking other conditions. Common symptoms include right upper quadrant pain or epigastric pain caused by hepatic capsule distension or hemorrhage, nausea and vomiting, headache, malaise, visual disturbances, edema. Clinical issue. These symptoms can overlap with other common pregnancy-related discomforts such as gastritis or viral illness. The key is to maintain a high index of suspicion, especially in women risk factors or those who are deteriorating clinically. Do not dismiss seemingly minor complaints, my beloveds. About laboratory diagnosis requires, laboratory diagnosis requires careful interpretation. So in every question there is an answer, my beloveds. Be careful and don't panic during the exams. Of course, laboratory diagnosis requires careful interpretation, definitely. But platelet count is the most important discriminator. So the classic triad, hemolysis, elevated liver enzymes, low platelets, is used for diagnosis, but cutoff values can vary. Hemolysis is demonstrated by elevated LDH, elevated indirect bilirubin, and presence of schistocytes or peripheral smear. Transaminase greater than twice normal are used for diagnosis. Platelet count less than 100,000 microliter is used for diagnosis. So clinical importance, the prompt availability and the accurate interpretation of lab results are crucial. It's okay for any of the other pathological conditions. It can be further classified into partial HELLP based on a degree of clinical manifestations. What else? Yes, HELLP syndrome carries significant maternal and fetal risk. Of course. From the question, we understand that. Of course. Maternal complications include the disseminated intravascular coagulation, pulmonary edema, acute renal failure, liver hemorrhage or even rupture, abruptio placenta, stroke and death. Fetal risk are primarily related to prematurity if delivery is required. So what is clinical issue of that? HELLP is a life-threatening condition requiring immediate, quick intervention. The potential for severe complications underscores the need for rapid diagnosis, stabilizations, and delivery. Delivery, next topic, next misunderstood questions. Delivery is the definitive treatment. Of course, but management before delivery aims to stabilize the mother. Delivery is the only cure for HELLP syndrome. However, if the gestational age is removed from term less than 34 weeks, attempts may be made to stabilize the mother with corticosteroids, actually, to promote fetal lung maturity, surfactant, etc., for 48 hours before delivery. Clinical issue of that. So the decision regarding timing of delivery must be individualized, considering the gestational age, severity of HELLP syndrome, and maternal and fetal condition. Close collaboration between the obstetrician, maternal fetal medicine specialist, and neonatologist is essential. About magnesium sulfate, yes, is used for seizure prophylaxis. We know that from eclampsia, but doesn't treat HELLP directly up to you how to pronounce. Magnesium sulfate is administered to prevent seizures, eclampsia, which is a major risk in preeclampsia and HELLP syndrome. It doesn't treat the underlying HELLP syndrome itself, of course, my beloveds. It's, if you want, it's a palliative management treatment, but not very good. Clinical issue of that. So understanding the purpose of magnesium sulfate is vital. It should be administered according to established protocols, guidelines, and close monitoring for magnesium toxicity. It's necessary. Recurrence risk in subsequent pregnancy is increased. Of course, Women with who have had HELLP syndrome in a previously have a high risk of developing preeclampsia or HELLP. In subsequent pregnancies, the recurrence risk for HELLP is around 3 up to 5%. But I repeat it several times. Remember that, my beloveds. You have to explain that after delivery, if you do not have these problems again, my dear future mommy, present and future, you have to drink a lot of water, avoid dehydration. If you want a next normal pregnancy without intoxication, mathopathy, etc., and future complications, you understand what complications are. So avoid sugars, diabetogenic so-called fast sugars, physical activity, but the principal point is the drinking water. So clinical importance, these women require close monitoring during future pregnancies, including early screening for preeclampsia, low-dose aspirin therapy, why not? Initiating the first trimester, and education about the signs and symptoms of HELLP. That's all. So thanks for your attention. Don't forget to follow and subscribe my Dr. Y YouTube channel, my beloveds. And don't forget, principal point, to subscribe my private Dr. Y Telegram channel. How to find this Dr. Y Telegram channel? Tap in searching mode in Telegram, Dr. Y, W-H-Y. Dr. Y, it's me. Without question mark, of course. Doctor, just W-H-Y. You find the site. This is a bot, actually. Click start. Choose your plan. It's not costly at all. Stay blessed. Thanks.